in another term, have leiomyoma. We have like 4 types of fibroids. I want to overcap them for you. First one is pedunculated, okay, as we can see in the image over here. Second is going to be intracavitary. Third is intramural. Fourth is submucosal. Fifth is subserosal. So 5 again: pedunculated, intercavitary, intramural, subserosal, and submucosal. 5. We need to learn them. So now I remember going through a question. I'll come back to this later. So patients with symptomatic submucosal fibroids who desire future fertility are treated with hysterectomy, myomectomy. So what type of, this is an important question here, I'll hide the answer. What type of fibroids are associated with heavy menstrual bleeding and or recurrent pregnancy loss? So we have to think about that. What type of will cause recurrent pregnancy loss and menstrual bleeding? That's going to be any sort of polyp within the uterine cavity. So we spoke about intracavitary. That's a big one. Or we can speak about submucosal. So we got it over here. So what type of fibroid is most associated with bulk-related symptoms and irregular uterine enlargement? So bulk-related symptoms means like pelvic pressure, heaviness, and discomfort, and urinary incontinence and constipation. We spoke about this as well. Pedunculated or subserosal? Pedunculated, subserosal. Okay, and then we can see what is going to be the diagnosis in a woman with labor pains and despite recently having her periods. Pelvic examinations irregularly enlarged uterus with dilated cervix with a firm mass visible through the external os. So this is going to be what type of fibroid. This is a bit tricky. It's going to be prolapsing uterine fibroid. So these are going to be typically intercavitary fibroids that prolapse to the cervical os, and that is going to be the labor pains and the cervical dilation. So we can see also over here uterine sarcoma. It is going to be distinguished from fibroids, but it can be suspected in postmenopausal women, usually solitary mass necrosis hemorrhage. Okay, now there in the next question over here is how we treat fibroids if we cannot use OCPs or NSAIDs. That's going to be GnRH agonists such as leuprolide. If we're going to give GnRH agonist in pulsatile form, that will cause increase. That's going to be problematic. But if you give it in continuous form, that's going to be antagonism. So that's going to be reduction of the estrogen over here. I just wanted to say that I also came over a question that what is the treatment for fibroids? And the answer was progesterone IUDs. Progesterone is very good to antagonize the effects of estrogen. Then over here, I came over a CMS question. What is the cause of sarcoma, uterine sarcoma? That's going to be pelvic radiation. So that's malignant proliferation of myometrium or stroma of the uterus in postmenopausal. I went for estrogen. Estrogen is more endometrium. This is more like myometrium, so it's a bit different. And we can kind of think radiation damages DNA, and that damaged DNA builds up in the uterus. Okay, so I want to recap, guys, for you guys. What are the 5 types of fibromas? Pedunculated, intramural, submucosal, subserosal, and intramural. Okay, how are you going to treat them? NSAIDs, OCP, leuprolide, progesterone IUD. What is the risk factor of uterine sarcoma? That's going to be radiation, because radiation causes DNA damage, and that can lead to malignant proliferation. So hopefully you find this video useful, and hope to see you guys next time.